have heard yesterday Nicola Sturgeon up in Scotland, back to her old ways, talking about dire consequences of not being able to control COVID properly come the autumn, dire consequences if people don't behave themselves and don't act as if they've got COVID, dire consequences if they don't lock down the economy and put on further restrictions. It looks as though Mark Drakeford might be trying to do the same thing over in Wales later on today. But more important for me is a story in the Telegraph this morning which says this: deaths in Britain are above average for the 6th week running, as experts warn the cost of disrupted healthcare and lockdowns may be starting to show in the figures. A total of 10,372 deaths in England and Wales were registered in the week ending August the 13th, according to the Office for National Statistics. Put that up against the 600 deaths that we keep being told are from COVID, and you'll get a pretty good idea of how skewed the rest of the media is, because all they tell you about is the number of people that died from COVID. 10,372 versus 600. I mean, there's no contest, is there? Let's talk to Jamie Jenkins, independent statistician and political commentator as well. Jamie, very good morning to you.
Good morning, Mike. You well?
Yeah, very well indeed. I'm fascinated as to why we still keep getting this ludicrous menu of COVID statistics every single day from various broadcast media, particularly Sky and the BBC, who seem absolutely obsessed with telling us how many people are dying from COVID, how many people have been infected with COVID, how many people have been vaccinated against it. This is a far more interesting story, that so many people are dying from unknown causes, clearly related to the obsession with COVID, which is stopping anyone from being treated for anything else.
The point you're making, Mike, is this kind of thing that's been creeping up over the last few months, and I've started noticing in the data about 5 or 6 weeks ago. And you're right. So what? Let me just explain to the viewers and listeners what we mean by excess death. Yeah. So you can look at the number of deaths in any given week, or any given month, or any given year, and then you can look at what the average level of deaths would be for the time of year. And throughout the first wave last spring, and throughout the autumn and the winter, we did see this huge rise in excess deaths. And predominantly that was mainly due to COVID. And I've been looking into the deaths figures around that period, and we can perhaps talk about those in a little bit. But let's focus on what's going on today. So the last few weeks, 6 weeks, we have been seeing excess deaths kick in again. And when we were seeing excess deaths during the peak of the autumn and the winter and the spring, the media were talking about this COVID all the time. But we are starting to see some unexplained excess deaths, because when you go back to the kind of the height of the pandemics, Mike, you would see this huge spike in deaths, and it was mainly COVID. So you think back to kind of the height of the winter, we were seeing 1,300 deaths per day in the UK from COVID. It's around about 85 deaths at the moment. So the excess deaths, we're probably seeing just as many, if not more, excess deaths in the figures that cannot be explained by COVID. Now, if you dig into the figures into a little bit more, this is where potentially the thing you've been championing for the last few months, Mike, might be kicking in that if you look at the place of where these excess deaths are happening, we've seen now since last March, more deaths occurring at home every single week. Now, this isn't just 1 week, this is every single week since last March. You're talking 18 months now at home than what you would expect. Since kind of March time this year, we've seen fewer deaths than you would expect in hospital. So there seems to be people dying, and maybe this unexplained because they're not going to hospital. We see more people die from home. And I think this is probably an element, Mike, of people just too scared to still go to the NHS, or the NHS isn't open for business because we're still not up to the capacity we had before the pandemic.
Yeah, but is it unusual for so many of the deaths to be put down to unknown causes?
Well, I think what the newspaper headlines are saying unknown causes is because the weekly figures that we get from the ONS, they only talk about how many deaths there have been from COVID and just how many deaths overall. So I think we'll get in time, we get the monthly figures from the ONS that talks about kind of deaths. So in the next few weeks, we'll probably get a better picture from that. The reason I think the newspaper headlines are saying unknown causes is because each week we don't get the cause of death. So we will kind of pick that up. And what I've been looking at, Mike, in the figures, because it's important to say there have been excess deaths from COVID. There's excess deaths at the moment from other things. And we've got a running total at the moment, Mike, about 156,000 deaths from the ONS across the UK, where people have had COVID-19 mentioned on the deaths. So a huge number, but we can break that number down, Mike. And I think that's overinflated. And let me explain to you why when you actually start breaking it down into the data. So what we know is that you basically get a death that's registered, and then they might mention something on the death certificate. We know there's that 156,000. Now, for about 13% of them, Mike, COVID wasn't the main cause of death. So you
Right.
can kind of exclude those. But I've been looking at the figures for this year, and remarkably, we're seeing fewer people dying from dementia and Alzheimer's disease,
Right.
fewer people dying from respiratory diseases. And what you could infer from that is that people who probably would have died anyway from these diseases are now being put in the
Yeah.
COVID death because they tested positive for COVID.
Well,
So,
particularly
so the
when you're
point that
looking,
me,
yeah, when you're looking at your statistical figures here, where you got chronic lower respiratory diseases down 32%, 16% fall in deaths from dementia and Alzheimer's, 53% lower on flu and pneumonia. That can't be because nobody's dying of those things, can it?
no, I think flu and pneumonia, Mike, the hygiene measures to control the kind of the pandemic, you would probably expect to see flu and pneumonia deaths coming down. We know we've had a little flu circulating the last year, but these other causes of death now, dementia and Alzheimer's disease is the main cause of death in the country, and you wouldn't suddenly see this drop in dementia and Alzheimer's death. So I think what we're seeing, Mike, is the people who sadly would have died of these diseases anyway are in the COVID figures because they've tested positive for COVID. So I think the point I'm making here is that because if you go back a few months ago, people were talking about. I think there was one day where there was 0 deaths announced, and that was on a Monday where there's normally low deaths. The point I'm making is that we're going to have to accept a level of deaths because COVID is endemic across the world now. It's going to be in the country for forever probably.
Yeah.
And we're seeing people now who probably would have been dying of Alzheimer's and dementia diseases, for example, now dying with
Yeah.
COVID. We're never going to get to 0, Mike. That's the point I'm making.
Well, of course
here.
not. But also, Jamie, the thing that really grinds my gears is when you hear these experts, so-called experts on various different outlets, whether they be radio or television, talking about, well, it's all very well to say that more people die from other things than die from COVID, but you're still adding to the numbers of deaths because people are dying from COVID, which they weren't dying from before COVID existed. Well, up to a point that's true, but it's not entirely true because you can't separate out everybody who died from COVID because they would have died of something else, as it were.
Yeah, and that's kind of where the excess death figures are important, Mike, because if we see deaths over and above average, which we did last spring and in the kind of the winter months, clearly an issue. The vaccine rollout's been a kind of a success for the government, I suppose, which has meant that if you look at deaths in relation to cases, Mike, they're 90% lower. They're relatively low to what they were before.
Right.
But nobody's talking. You don't see for example, on the BBC News headline, why are there excess deaths from other things? And it's scandal is bound to be, Mike, that people are not getting the healthcare or they have not seen their GP for the last year, which has meant that conditions have transpired. It's too late to sort of save them, and we're going to have this now, I think, for many, many months going forward, Mike, of people dying of things unnecessary because of the obsession we've had, probably rightly at the start, but maybe not so much now, of COVID all the time.
Well, that's the problem, and it's also terribly misleading. And yesterday we saw Nicola Sturgeon, Jamie, talking up in Scotland about bringing in more restrictions possibly in the autumn because she's saying that that basically the number of cases is rising as rapidly as it was back in March, and in fact the number of infections is at its highest rate since March. What do you make of that?
So interestingly, Mike, with Scotland and Wales, obviously they eased their restrictions in August, whereas England went a little bit earlier on July the 19th when Boris delayed it from June. And if you track the kind of the cases across the country at the moment, they are going up fastest in Scotland and Wales.
Yeah.
And interestingly as well, Scotland and Wales do seem to have some kind of more restrictions. So I think you've got to have masks in places where you don't have to have them in England. They're relatively low in England at the moment. They're not increasing much. And the rates I think the rates have increased a little in the southwest because of a load of 15 to 19-year-olds testing positive due to a festival. So they are going up, Mike. But I think the important thing here is in Scotland, they started going up before the schools went back as well, because I think a lot of people are jumping on, the schools have opened in Scotland and the schools aren't open in Wales as well. And I think what we might be seeing, Mike, is the backfire of Mark Drakeford in Wales has been saying staycations, everybody come to Wales to go on holiday.
Yes.
And probably because everybody's crammed in places now where you probably, because there's fewer places to go, we're probably seeing the effect of people not going on holiday abroad, increase in the COVID numbers potentially in Wales and Scotland. So that kind of policy is backfired. So I think what's been interesting, Mike, is what's going on in Germany at the moment. So they've announced this week that they're no longer going to be tracking COVID cases to decide if they want to put in restrictions, which is obviously Mark Drakeford and Nicola Sturgeon are talking about.
Revolutionary.
It's revolutionary. But I think what we've got, Mike, and this is my big concern this winter, I can just see the kind of, in about a month's time, you'll probably be back on the show because there'll be restrictions coming in certain parts of the country, is the NHS. And have anything been done to increase capacity for the NHS this winter? Because before the pandemic, Mike, in the UK, we had 2.5 acute beds for every 1,000 people. In Germany, it's 8 beds. In France, it's 6 beds. So if you go back every single year, from what I can remember, like in my, my adult life, the NHS seems to have been in crisis with more and more
Well, it's
people.
always in crisis. Also, you can't find anyone who actually speaks for the NHS because there isn't anyone. There's so many people running it that nobody knows who's actually in charge. I mean, I don't know, for example, and I don't know whether you do, whether they've gone back to the normal spacing of beds in wards, because we know, for example, they removed about a third of the beds at the beginning of the pandemic because they wanted social distancing, which didn't actually work because people got COVID more in hospital than they got it anywhere else. So that was a waste of time. But I bet you any money they haven't put those beds back in, thereby increasing the capacity for all sorts of different reasons.
No, Mike, and that is, I think that is right. They haven't increased the capacity because I know that there were some incentives going out to health boards in England to try and get capacity back to 95% of what it was pre-pandemic. And it's in part of the reason, Mike, why Sajid Javid, the health secretary, has been coming out talking about the fact that the NHS waiting times are going to continue to grow and grow and grow and go from what they are now, probably double and even more so.
Yeah, but I mean, this is the guy who's the Secretary of State for Health. What the hell is he doing? Why is he standing there saying, oh, the waiting lists are going to get longer, it's all going to get worse? Why doesn't he fix it?
Well, and that is the problem, Mike. We've got this huge backlog of people who haven't gone to the NHS. Sadly, I've said before, I think people are going to die before actually getting the treatment on the NHS. And maybe that is what we're starting to see in the figures now, because there's no explanation for these excess deaths that are not COVID at the moment. And if we're going to continue to see deaths rising like this because of the backlog of the NHS, this is why, Mike, I think we've got to consider now what we didn't know last March is the impact of all of the kind of restrictions on lockdowns on everything else. We've got 18 months worth of more evidence now. And if we ignore all of that and just, for example, follow a New Zealand model and Mark Draper and Nicola Sturgeon saying may bring restrictions in, I think it's madness to ignore everything we've learned since last March.
Well, exactly right, because you and I have often said, Jamie, the whole point of dealing with this problem is to recognise that it is here, it is something that we're going to have to deal with and live with. And quite frankly, if it was so brilliant that all these lockdowns were so good at working, then why are the cases going up again? Because you've still got plenty of restrictions in Scotland. There's still plenty of places you can't go without a mask on. So what the hell is the point of that?
And you've only got to look at New Zealand now, Mike. They've had some of the toughest restrictions in the world. And they went into this snap lockdown. They've extended their lockdown because cases are continuing to rise. I think yesterday they've had their largest daily rise since the start of the pandemic last March with all of these restrictions in place. And it basically, I think what we've learned, Mike, is this virus will get around. And it all comes back down to the vaccine rollout and people who've had prior infection. The good news, Mike, I suppose, when you look at the figures, is that with the cases we got at the moment, deaths are 90% lower. People going into hospital are 80% lower. This isn't a new thing that's come on us like we saw last March. So why would we be looking at the NHS not increasing capacity this winter? I know you can't train staff overnight, Mike, but I think it would be very disappointing for the public if we go into any restrictions this winter if the government has done nothing to prepare us for a kind of a surge that may or may not happen.
I mean, listen, I'm not giving the government a pass here, but certainly the Secretary of State for Health should be getting his feet wet and his hands dirty. But it's the NHS that's the problem here, Jamie. But stay with us for a minute because we're going to take a little break and we'll come back and talk a bit more about the NHS in general, which is absolutely and utterly shambolic, as we found out yesterday with so many of you calling in to tell us stories of how you can't get to see a doctor, how you can't get into a hospital, how if you ever go into a hospital, it's completely deserted. If you ever go into a GP surgery, it's completely deserted. Meanwhile, we're hearing about all these people who are dying from unknown causes, apparently, nothing to do with COVID, and in a way which is making the numbers rise exponentially for the 6th week in a row. Something's going on here, ladies and gentlemen. This is Talk Radio. Back to the Independent Republic of Mike Graham right here on Talk Radio. We're talking to Jamie Jenkins, formerly of the ONS, independent statistician now, of course. I'm looking at another story this morning, Jamie, in which it says NHS faces crisis as doctors who put off retirement depart. Basically, they're making out that all these doctors who were going to retire during the pandemic, who didn't, are now going to retire because now the pandemic's supposedly over. So that'll be another crisis for the NHS to face. I mean, it just seems to me that there isn't anyone who's held accountable for the badly run sections of the NHS.
Well, I think what I always find surprising, Mike, I used to head up the team at the ONS as well on kind of labour market employment statistics as well, is that, and what you would normally do is if any business, and the NHS is a large kind of business, I suppose you could say, with the number of people it employs.
Yeah.
You do some forecasts. So when you suddenly get, oh, we've running out of doctors or we're running out of nurses, it just makes absolutely no sense because we know how many elderly people there are in the population. And one of the things that's kind of putting more strain on the NHS in recent years has been, a good thing for humans is we're living longer. But when you live longer, it puts more strain on the kind of the NHS. But it only puts more strain on the NHS if you don't plan for this. So to get this sudden story that people who are planning on retiring didn't retire are now going to plan on retiring, well, the question for me, for the government, is what the hell have you been doing for the last 10
Right.
years? Because this isn't something that just happens overnight, Mike, these kind of issues.
No, of course not.
And it's just a scandal.
Well, of course it is. I mean, we were speaking to some people yesterday about various different aspects of their experiences with the NHS, and one woman called in to say that she had I think a relative who was a doctor who was struggling because so many doctors are now leaving GP practice to go and become locums because they get £1,000 a day for doing it. Now, I don't really blame people for doing that, but surely if you want to be a GP and you want to be a general practitioner and you want to help in the community, you don't just become a sort of gun for hire, do you?
Well, money talks, I suppose, Mike, and that's another is a huge problem with the NHS as well. With regards to, I know stories, Mike, where people are working in the NHS, they leave their job, they go and work then for kind of what would be a bank nurse, go back to the same hospital, practically doing the same job on more money.
Yeah.
But obviously somebody's taking a cut of all of this, and it's our taxpayers' money.
Well, it's the agency business, isn't it?
Yeah, it's all this agency thing, and people have said, well, good on them, I think, get more money working for the agencies. But then it's a kind of the chicken and the egg problem you might, because if you tell the agencies we're no longer going to use your people, they'll say, well, you're not going to be able to run the hospitals. But ultimately, if the NHS is the big demand of all of these agency people, if they say we're no longer going to take you, these people who are going to these agencies, getting all this extra money for that, and then the private sector taking a cut out of it, that can't happen, can it, Mike?
Well, that's the problem. But as I say, the biggest problem, I think, in the NHS, in this country, certainly in England, is that there isn't anyone that you can go to and say, why can't you fix this? Because there's all sorts of people in the way. There's tens of levels of management. There's all sorts of, instructions being given out by 85 different people. And everyone I know that works in the NHS, particularly in hospitals or in clinical kind of situations, says it's an absolute shambles. They order stuff they don't need. They've got, cupboards full of stuff that they've ordered that's been sitting there for so long it's out of date. Nobody's forward planning. Nobody knows what's going on, and it will be once again another disaster come the winter.
And they're the kind of things you've highlighted. I had a friend who worked in the NHS on procurement, and he was talking about, come the end of the financial year, can we order a load of new desks so that we can use the finances up for this financial year? If we looked at all of this money and all of this waste, it's going to add up to a large number, which, the NHS sucks a lot of taxpayers' money already, Mike. And I think the thing, just on the GP thing that you've been talking about for the last, not just few months, probably for the last year now, Mike, is that I think there's been this switch towards, if you're lucky enough to get a telephone call back or a face-to-face is very rare now, and getting a video call back. What that is, I was reading a blog from a GP, and obviously being a statistician, this is just one blog, I'm not saying this is representative of all GPs, but it does resonate with what you were talking about, where they were saying the surgery would normally have been full of people over the age of 75 in normal times, and they'd pick up all of these kind of illnesses that will need urgent treatment and things. They're not seeing any of those anymore. They're not coming to the surgery because they can't get in, and they're less likely to want these phone calls or kind of video things because of the technology side of things. So the numbers, Mike, that we started the interview talking about, with more and more people dying, and they kind of, we say unexplained because they're not COVID for the time of year, it is probably because people aren't seeing their GP. They're then ending up kind of very late, either being rushed into the hospital, and then they're sadly dying. And, the GP system needs a massive overhaul. I think you've been highlighting, Mike, the issue that they're paid per number of patients, not how many you see. And if that's probably where we need to start the kind of radical overhaul of the NHS.
Yeah, I couldn't agree more. Jamie, great to talk to you as ever. Thank you very much indeed. Jamie Jenkins, independent statistician, political commentator. You should read his blog as well, because as he says, the number of people who would have died from dementia and Alzheimer's disease and chronic respiratory diseases are now apparently being counted as COVID deaths because they're all down. Every single one of those areas is supposedly down percentage-wise year on year. So what you know about that is that, of course people are still dying from dementia and Alzheimer's disease, but they're being put down as COVID deaths, and that's not right, is it?